Good morning, good afternoon, good evening. This is Dr. DeShavo. I'm making a quick video because there's a bit of confusion about the case studies, and I thought this would be a good way to clarify. So I've gone in, and in the sections, I have, under discussion, cleaned up the discussions. So you should see now week 6. Some people submitted in week 1. That's okay. I left week 1 open in a different section, and this is my section. So you're going to see different names, okay, depending on which section it is. There's 5 sections running. This is my section. So here's week 6 now. You'll see your name is now listed. I went through and I put the names under all the weeks. So this past week was week 6. You could see everybody submitted here. You're supposed to post your case study in this section, and then your guess as to other people's case studies here, because this doesn't show you in this section other people's posts. Okay, so your case study and your responses here, your guesses at diagnosis here. Okay. Now, after your week is completed, you could also post your actual diagnosis here so people can see it, okay? And take a peek. Let me turn this drawing tool off. So if I pan down, you'll see everybody's name for week 7, week 8, etc., etc., okay? You only need to participate the week that your name is on the list. That includes your case study as well as your responses. You do not need to respond to every week. All of the directions are here, okay? And it says right there, you're assigned to 1 week, okay? That's the only week, oops, that went off a little bit to the side. You need to participate. During that week, create 1 case study, respond to 2, then post your diagnosis. You get your 20 points, okay? Here's when things are due. Post your case study by Wednesday. You get 9 points. The diagnosis the week after. Read through the directions about how you do that there. Okay. I even give you an example of a case study. Okay. Don't use actual patient names. Use the patient. It's kind of the way that they're going with testing in the NP program, so I figured we should adhere to that. Now the responses need to be thorough and complete. Respond to 2, choose 2, comment on the content. Please don't comment on, you look great, your hair looks pretty. I have students do that. That's not what we're looking for. We're looking for you to research and read about the case study that that student has created. Okay, full paragraph, at least 1 cited reference or resource. After the week is over, you post the diagnosis for your actual own case study. We'll review them the week after, okay? So don't expect us to grade them immediately. We'll grade them the week after. And let us know if you stump your students, and we'll check it out and see if you did so, and you get an extra credit point, okay? That's trying to get you to do some fun case studies, okay? So there's the directions. This is all under discussion. Now, if you look at content, under, I'll pull it down a little bit, all tests and rubrics, the rubric is how we grade your case study. Take just a minute for this to open. We're literally going to copy and paste this for you, and it will be in the grade book. Under the grade itself, I think you would just click it to see our responses. But it's all laid out here, guys. If you want to get all your points, please follow this, okay? To get excellent, you need to complete this. For 2 responses, for both the responses, you need supporting material to support your diagnosis, comments regarding the case study, and thoughtful support for your diagnosis. You know, Mrs. Smith, or the patient has, sorry, don't use names, sorry, bronchitis. I think she has bronchitis because in this study from et al., they declared that, raspiness near the bronchioles and wheezing, denotes bronchitis or whatever it was. I forget what I was trying to explain. Do things that support the actual diagnosis. So this is to get you dig a little bit deeper into these concepts and learn a little bit about these conditions. As far as content, you could use any content you want. It does not need to follow the weekly content. Okay? So that is your rubric. It's right in the course, so you can open it right up, follow it exactly to the T, and get the points that you want to get for your case study. Okay? So if you have questions, don't forget all of the sections have their facilitators. Reach out to them. Please have a little patience when you reach out to them. Give them at least 24 hours, as they all work full time. They're doing this part-time. And that should, I think, help clear things up. All right. Thank you very much and have a great day.